Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi. And the second session is from 8:30 to 9:30, the international session in English. And from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friend, whether he or she be a homeopathic doctor or a student or a lover of homeopathy. And let me come to today's guest. As you all know, it is none other than Dr.MARIAN SALCEDO. She is the coordinator of IFPH for the Latin American countries, and she is a very important person in this forum, and she is doing a lot of work for homeopathy and promoting homeopathy as well as building homeopathic foundation everywhere in the world. And she is also one of our chief translator for the people from other parts of the world. And she is from Bolivia and is a homeopathic doctor, Argentinian Homeopathic Medical School of School Thomas Pablo Hacio, and she had a Bachelor of Medicine and Surgery in University of Bolivia, and she is a homeopathic physician from, as already mentioned, the member of the Thomas Pablo Psycho Homeopathic Medical School. She is MP, member of public health mention epidemiology, universal mayor of San Andreas, and master in phototherapy, class in Chile, and postgraduate in phytomedicine, Buenos Aires, and principal investigator of integrated medicine research team, hospital and the clinic La Bolivia, a graduate professor and research methodology, Loyola University, Bolivia, and author and principal investigator in several double-blinded randomized controlled clinical trials. And she's a postgraduate teacher, Loyola University, Bolivia, and a postgraduate director, Loyola University of Bolivia. And she is a postgraduate classical homeopathic course coordinator, Loyola University. And she has more than 18 years of clinical experience and is present in so many excellent sessions in this forum. And today, Doctor will be talking about another important research paper, that is varicose ulcer and intercurrent disease analysis. So definitely, as we all know, that the varicose ulcer is one of the area where homeopathy can do wonders, and the results are excellent. Sometimes we can avoid surgeries by using our medicine. So let's see, Dr. Dr.MARIAN Salcedo has to say about this. You are welcome, madam.
Thanks, Dr. Daneshi. I was missing you all. Thanks for your kind words. I'm just doing the best that I can, not always as I would like to do, but okay, here I am. So thank you very much. At the first step, I apologize because English is not my native language, so please, I will ask you your tolerance for my mistakes in grammatical or maybe in the pronunciation. And then I will share my screen with you. Okay, so now can you see it?
Yes, yes.
Okay. Thanks so much. So I will share with you a case of varicose ulcer of one of my patients. That was a very interesting and incredible follow-up. So this is the case. Okay, so it's a lady of 72 years old, no chronic disease, ordered life habits, a chili patient, antecedent of dyspepsia, desire sweet food, and on January 10 of this year present a right feet ulceration. So my question was, what is happening here? Is an intercurrent disease, is an acute disease, is an accident? So it starts like an accident with a nail and start with a very slight wound. But then it was getting deeper and deeper and was just in a few days and an important ulcer. So this is the first photo. You can see it. It was just made with the nail by an accident, and it started the ulcer. And just a few days was taking a very, very important part of the skin. So let's remember what Hahnemann says. The master says that we must now consider intermittent disease, not only those that recur at definite intervals, such as large number of intermittent fevers and apparently non-febrile recurrent complaints, but also those in which particular disease condition alternate with others of a different nature of indefinite intervals. So I was thinking the first time if it was just an accident and ulcer by the nail, but in the time was getting worse and deep. So I changed my view to an intercurrent disease. Okay, so the question was what I have to do now with this. And I just go to the Organon 6th edition of Dr. Samuel Hahnemann. As our master, he always know what we have to do. And there is, everything is writing, all his thoughts and all that we have to do as a method is right there. So he says that it's very important, according Hahnemann, in the organ of the medicine, it's important the treatment of intermittent disease because it involves several specific steps based on the provided experts. Here is a step-by-step description of the principles and methodologies he outlines. To identify the nature of the disease, recognize that intermittent disease can present as recurrent conditions, often manifesting at definite intervals, which may include types like intermittent fevers or other non-febrile recurrence complaints. Is essential to determine if the disease is a product of developed SORA or complicated with syphilis. For understand the symptoms, a precise understanding of the symptoms that manifest during the disease active phase is crucial. The symptoms outside of the attack also play a vital role in choosing the correct remedy. The third thing is to select the homeopathic remedy. Identify and select an homeopathic remedy that corresponds with the symptom picture. Hahnemann emphasized that the remedy must match the disease state and may ideally reproduce similar symptoms in a healthy individual. Select remedies that correspond to the characteristic phases of the disease, cold, heat, or sweet, in cases of intermittent fevers especially. Then we have to administer remedies in small doses. Administer the select remedy in small potentized dose. The focus is on using minimal dose that suffice to bring about improvement without overwhelming the patient system with excessive medication. To monitor patient response, continuously observe the patient response to the treatment. The administrations of the remedy should be repeated as long as the patient shows steady improvement without emergence of significant new symptoms. And to adjust treatment as necessary. If the patient develops new different symptoms during treatment, or if the disease manifestations persist, it indicates a need to select a different remedy that is more homeopathically appropriate. This adjustment is essential for optimal treatment outcomes. And we have to consider the use of intercurrent remedies. In alternating disease, intercurrent remedies may be administered to address symptoms to arise between the primary boats, particularly if they exhibit distinct characteristics of complications. And finally, we have to address external factors. Hahnemann advised considering external factors that may aggravate symptoms. Removing these irritants can aid in the healing process, allowing for a more straightforward path toward recovery. So this step-by-step approach highlights Hahnemann's meticulous strategy for treating intermittent diseases. emphasizing individualized treatment based on symptomatology and careful monitoring of the patient's conditions. So why we have to treat intermittent diseases? So once again, according to Dr. Samuel Hahnemann, in the organon of medicine, intermittent diseases must be treated for several reasons. One of them is the recurrence of the symptoms. Intermittent diseases, by their nature, involve episodes of symptoms that return periodically. Without treatment, these symptoms can disrupt a person's life and may lead to chronic condition or complications. Underlying cause. Hahnemann suggests that this disease may arise from historic miasm or other underlying factors that, if left untreated, can perpetuate the illness. Addressing the root is crucial of a permanent cure. Improving patient quality life. Treating intermittent disease can significantly enhance a patient's overall well-being and quality of life by reducing the frequency and severity of symptoms. Patients are more likely to experience a steady state of health when effective treatment is employed. We have to avoid complications. In certain cases, untreated intermittent disease can lead to further health complications. For example, chronicity can set in, or new symptoms may manifest due to the ongoing health disturbance caused by the intermittent conditions. Preventing the disease from becoming chronic. Dr. Samuel Hahnemann implies that if not adequately addressing, intermittent disease can evolve into chronic conditions. Early and appropriate treatment can help to prevent these progressions. So, in summary, treating intermittent diseases is essential not only to alleviate the current symptoms, but also to mitigate the risk of chronicity, improve the quality of life, and address any underlying causes that may contribute to disease recurrence. So this is the approach to taking the clinical case of an intermittent disease. We need the detailed case taking. The physician, the doctor, must collect comprehensive information about the patient's health status, including the specific characteristics of intermittent diseases. This involves documenting the frequency, duration, and nature of the symptoms during different phases of the disease. Observation of the variability that he speaks in the aphorisms 248. Hahnemann emphasized that each phase of the intermittency should be carefully observed. Symptoms can vary significantly between attack, and understanding this variation is crucial in selecting the most appropriate remedy. The treatment should continue as long as the patient shows consistent improvement and does not present any significant new symptoms. If new symptoms do arise, indicating a change in the disease, a different, more suitable homeopathic remedy should be selected and administered in modified doses, ensuring the solution's potency is adjusted before each dose. Identifying background health, that is in aphorisms 246. The clinician should assess the patient's overall health and any chronic conditions that may coexist with the intermittent disease. This includes attention to the patient's constitutional symptoms, as these can influence the remedy choice. We need a symptom assessment. When evaluating the symptom, it is essential to prioritize those that are most characteristic and strongest. Hahnemann notes that the remedy selected should correspond as closely as possible to the remedy that could evoke similar symptoms in the healthy individual. And consideration of the external influences. It is also important to take into account any external factors that may influence the intermittent disease, such as environmental triggers of lifestyle factors which can provide insights into the management of the conditions. And we need to reassessment post-treatment. After administering treatment, Hahnemann suggests ongoing evaluations to determine the effectiveness of the remedy. The physician should look for signs of improvement or any new symptoms that may necessitate a change in the treatment plan. Hahnemann advises a holistic and detailed approach to taking the clinical case of an intermittent disease, focusing on thorough observation and understanding of the patient's symptoms, overall health, and external factors, followed by the careful assessment after treatment. So this is here you have a very short summary about all these aphorisms that Hahnemann wrote in the organ. So just to get a clear idea, we must remember what is an acute local disease according to Dr. Hahnemann in the aphorisms 73, 74, 186, 187. So acute local disease are diseases caused by external factors, trauma, infection, intoxications, with a rapid onset and self-limiting course. But we have to remember as well what is an intercurrent disease. This is an acute condition that appears during the treatment of a chronic disease and may interfere with the progression. Important to review the, for instance, 38 to 42, 33 to 73 to 74, 182 to 184. And miasmatic disease. That is long-term disease caused by SORA, psychosis, or syphilis, which persists without proper homeopathic treatment. And this is the aphorism which the master just described these miasmatic diseases. So what is a varicose ulceration? A varicose ulcer is known as a venous ulcer and are chronic skin lesions that typically appears in this sector of the leg. So we have a typical localization that is on the lower legs due to the chronic venous insufficiency. As we can see, the patient has that venous insufficiency. These conditions occurs when the valves of the veins fail to function properly, causes increased venous pressure and decreased venous return. This is the result in fluid leakage, inflammation, and eventual breakdown of the skin tissues. So this is the typical localization, inner part of the lower third of the leg, near to the medial malleolus. We have an irregular but distinct borders. This is very, very important. I learned that in homeopathy, you have to see the borders of the ulcer just to think in some remedies. We have moist space with serous or purulent exudate. It's according of the stage of the ulcer. Pain that may vary from mild to severe and is relieved but elevating the lip. That is very typical. There may be leg edema and feeling of heaviness. And also there could be changes in the surrounding skin, hyperpigmentation, varicose eczema, and lipodermatosclerosis. So all these clinical characteristics are about the illness. So when I remember these clinical characteristics and I saw the lesion, I just decided that that was the nosological diagnosis. Okay, so in my patient, the clinical case, she has the varicose antecedent. This current picture of the illness was a trauma antecedent. Start with a superficial wound, but just in one day was a very deep wound. The symptoms was burning pain, difficulty of movement, and chilly patience. So here you can have some idea. So just for learn about that, I take my repertory. I take from Patak, from Kent and Near, all the varicose veins that has two tendencies to the ulceration. For example, is just fluoric acidum. And that kind of distended full varicose veins ulceration, we have a lot of remedies, but maybe these were the most important. Lachesis, pulsatilla, fluoric acidum, lycopodium, arsenicum, capsicum, hamamelis, silicia, and vipera. Yeah. So just having another kind of symptoms from Nair repertory, Patak, Boker, and Kent, like blood vessels distance veins, varicose veins ulceration, blood vessels distinct with full varicose, ulceration painful. This is very interesting because it has just 6 remedies. Silesia is one of the important one, and arsenicum. And the thirst of small quantities 4 was a symptom of my patient, and chilliness. So we have this, I got that kind of remedies, pulsatilla, lycopodium, sulfur, arsenicum, lachesis, gina, chelidonium. Yeah, just to know what was happening. This is another repertory session that yeah, this ulceration painful, and have another kind of remedies, another kind of picture of that. In the mental area, there was no more symptoms. The chronic remedy that she was taking was carbobage, and carbobage was a very good and important remedy for varicose ulcer as well. And this is very interesting, in Boker repertory, he described ulceration painful, just 6 remedies, and there is carbovage, arsenicum, graphites, hepar, sabina, and silesia. My patient was taking for too many years ago carbovage, so I decided to try with the constitutional remedy as the first step. There was an improvement, but very slight. There was not the answer that I was waiting and that I had the custom to see with homeopathic treatment. So here we have a short review of some homeopathic remedies for varicose ulcerations. I just try to do my best, but it's a lot of information. So I just focus it on the ulcers of each of these remedies, just to have in mind a review and a reminder, and what about is how are the ulcers on these remedies. So I selected lachesis, pulsatilla, lycopodium, floric acidum, arsenicum, amamelis, silesia, and vipera, and of course there is carbobage, as my patient was taking as a constitutional remedy. The first step that I decided to do is just to remember how is the ulcers in the miasmatic aspect of all these kind of remedies. So we cannot forget about the miasmatic disease, the chronic diseases. So we have to review the clinical type of each ulcers. Dr. Samuel Hahnemann says that, for example, ulcer is not just the destroyer of syphilis. Soda can produce an ulceration. So we will just remember these topics. Dr. Samuel Hahnemann says in the chronic disease, the great majority of chronic disease are caused by the chronic miasm. It is only by understanding and treating this miasm that true and lasting cure can be achieved. So we have to remember that we have a psoric ulceration. The nature is superficial, irritating, not destructive. The appearance is soft, regular borders, scanty clear or yellowish serous discharge, little odor or no odor, and surrounding skin with itching, dryness, or mild eczema can appear. The general symptom of psoric ulceration is itching that improves when scratched. Anxiety, hypersensitivity, fear of suffering, worse in heat, better in fresh air. All these are the characteristics of psoric ulcerations. Psychotic ulcer. The nature is moist, varicose, infiltrated with a tendency toward chronicity. The appearance is thick, raised, irregular borders, thick, greenish or yellowish discharge, sometimes malodorous. There is hyperplastic tissue with bumps or granulations. The general symptoms are feeling of heaviness, congestion aggravated by moisture, suppression for previous secretions, vaginal, urethral warts, and tendency towards hypertrophy and chronic infiltration. And the last one is it's not well right, it's syphilitic ulcer. The nature is disruptive, indolent, progressive. The appearance is hard, blackish, or purplish borders, bloody foul smells discharge, blackish or dirty base with necrosis and tissue loss. The general symptoms are night pain, burning, staving, worse at night, and with warmth in bed. History destructive ulcerous process or hereditary syphilis. So my patient has that burning pain, but was during the day. And in the borders, yeah, really, this time I can saw that soft and regular borders. That's very strange in a varicose ulcer. And was very clear there were no discharge. So there was another big question for me. So let's review these remedies. The first one that the patient was taking was carbobage, and the area affected is the venous system. Deficient capillary circulation causes blueness of skin and coldness of extremities. Is worse with warm and damp weather. It's better being painted. And the characteristics of the ulcer is that it's more prostration than lachesis, cold perspiration, cold breath, and collapsed cadaveric odor, burning, pain with excretions in the folds of the skin. The edge of the ulcers are indurated. That was very interesting because I can saw that induration. But Carbo-1 animalis has the same characteristic, but not as a tender as in lachesis. It's burning pain, mottled appearance of the skin, as if small capillaries around the ulcer had enlarged, ecchymosis subcutaneous, all these ulcers having a remarkably dull appearance, superficial ulcers. So really that was the first step of that ulcer, that varicose ulcer. I treated was just a slight improvement, no more changes, and we had to relate carbobage with phosphorus in easily bleeding ulcers. That was not the case. This ulcer was not bleeding. That was so interesting for me. The second one is lachesis. The area affected is veins, hemorrhoids. Is worse by the touch directly, pressure, or constrictions and sun rays. That is so important. Just keep it in mind. I don't find the modality in the better way. The characteristics was a superficial ulcer, no discharge, sensitiveness in the borders, merely surrounding skin, weakness, coldness, edema, red swelling showing phlebitis, and intense pain makes her nervous. And there is a diagnosis, the differential diagnosis, carbobage. So that was very, very interesting for me because that was the next remedy that my patient needs. Just for a review, we have also Lycopodium and Pulsatilla. In Lycopodium, we always think that is that digestive, but Lycopodium is worse by burning and tearing sensation that is worsened by evening plasters and by any attempt at healing. It's worse from 4 to 8 p.m. Is better with warm foods and rings for uncovering the head, loosening the garments. The characteristic is the blue borders in the ulcer, burning sensation as well, offensive discharge, resistance to healing, golden willow pass, right side remedy, flatulence and dyspepsia. Complementary of lachesis, just to keep it in mind, if just one, she will need some touch of lycopodium during all the evolution, the follow-up. On pulsatula, the area affected is venous ectasis, is worse with warm closed room, evening, a twirling on beginning to move, letting affected limbs hang down, is better in open air, lying on the painful side, and the characteristic is the corneal ulcers with vascular development. This is related with silicea, is the chronic of pulsatilla. We have fluoric acid that in the repertory of Boger and Nair, they told that fluoric acid is just the single remedy who has painful ulcers. So they are affected is varicose veins and ulcers, obstinate, long-standing cases, capillary aneurysm, is worse with warm, is better with cold, violent pains like streaks of lightning confined to a small spot. The characteristic is the red edges and vesicles decubitus is copious discharge. We have to compare with calc fluor, tuberculinum in capillary aneurysm, and complementary with coca and silicea. The other remedy is arsenicum. It's worse from 1 to 2 p.m. and to 12 to 2 a.m. Is better from heat in general, reverse of cecal. And the characteristics of the ulcer is the blue borders, dark coloration, gangrene, vascular excitation, nervous irritability, and postration. Complaints return annually. The same thing in carbobeige, lachesis, sulfur, and tuja. So that was another remedy that I kept in mind. And yeah, my patient need some touch of arsenicum during all the follow-up of these ulcers. Mesoreum, that is worse at night by touch or motion. The characteristic is the ulcer with thick yellowish white scabs under with thick yellow pus collects. Vesicles appears around the ulcer, each violently bar like fire, like ever, shining, fiery, red areola around. And we have to compare it with causticum. Cecal is another great remedy for ulcers. The area affected is the slightest wound causes bleeding for weeks. Like lachesis and phosphorus, there is discharge of sinus liquid and blood and putrescence. It's worse by heat, warmth from covering. It's better with cold air, getting cold and covering affected parts, rubbing, and the characteristic is the dark coloration gangrene. The skin feels cold to the touch, yet the patients cannot tolerate covering. It's similar to arsenicum, but cold and heat are opposite in those. So this is the differential diagnosis that we need to remember. And these were so new for me, Vipera and Hamamelis. In Vipera, the area affected is blood and veins, is worse letting limbs hang down, yearly, cold, touch, change of weather, is better innovating, fast growing. The characteristics is bursting sensation, fullness, and unbearable pain, as if limb will burst. This is very important to keep in mind. Must keep part elevated with feet high and has the hemorrhagic tendency. This is very, very important. And we have to compare with elaps and pulsatilla. And we have hamamelis, that the area affected, the tropies, is venous hemorrhage from every orifice of the body. Varicose veins is the aconitum of the venous capillary system, according Clark. The characteristic is the hemorrhoids, bleeding profusely with burning, soreness, fullness, heaviness, wounds, insist, lacerate, contused, injuries from falls, checks. Hemorrhage removes pain and soreness, like arnica. And it has the chronic effects on mechanical injuries like conium. Is related with ferrum in hemorrhage and the hemorrhage diathesis. But when I was making all the review of the materia medica, just appeared a new remedy for me that was very interesting to discover it because I don't have it in mind. And just to be honest, I never hear about this remedy that in Spanish is called sol. And in English is called sun. So here is. And this is just a review, just to have in mind, like a new discovery for me. What is the sun remedy? The miasmatic profile is predominantly syphilitic and psoriatic. And this remedy is derived from solar energy alcohol exposed to the direct sunlight. It combines chronic tissue destruction with cutaneous and nervous hypersensitivity. The key clinical actions is extreme photosensitivity, headaches, neuralgias, burning sensation upon sun exposure. The solar-induced ulcers, erosions, and ulcerations on the face, neck, arms, darkened edge, necrotic or blood-stained bases. Is a nervous pain, burning sensation, searing, worsening with heat, and direct sunlight tends to recur seasonally. The modalities is worse at noon, is peak solar intensity, is better with rest in dark spaces, and we have summer recurrence pattern. Just to know and to match with my patient while we were in summer, and she has a very important photosensitivity, not in the ulcer in that time, but in general. So just to keep in mind the distinctive features that we have in the remedy is a unique in combination destructive ulceration, syphilitic, with solar hypersensitivity, psoric symptom. Is valuable in burns that evolve into chronic ulcers after repeat sun exposure. Is powerful remedy for neuralgias, seizures, and skin eruptions worsened by sunlight. So we can think in that kind of remedy in patients with photodermatitis with ulcerations, sunburns that ulcerate or become chronic, post-sun exposures neuralgias, and recurrent summer skin lesions that resist healing. That is the most important thing, to resist healing. So this was the prescription that I made, that I did on that time. This was the first photo of the ulceration. I just gave her a touch of carbo beige. She's taking carbo beige in LM scale. Currently, she's taking 31 LM. On that time, we start with 27, but there were no improvement, just a slight improvement. There were no big changes. And with carbo beige appeared the burning sensation and the thirst of small quantities, and the chilliness was worse. So then I decided to change to arsenicum album, as Dr. Samuel Hahnemann taught us. We have to make a very close follow-up of these cases because all the symptoms will be changing so quick. So I decided for arsenicum album, and when 1 week after, that was the result, just in 1 week. Obviously, we have dressings. We take care to don't have infections. And just in 1 week was so amazing for me and for the patient and for all the family, because in just 1 week, they were so close and the skin was with a better improvement. So this is 1 week after. I just kept with arsenicum album in this treatment in the LM scale. I start with 9 LM, and 1 week I changed to 12 LM. So 2 weeks after, just cluster appears. That was, the patient was waiting something 1 month without homeopathy, but just in 2 weeks, there were the cluster. So that was so impressive. So this is a following up by photos. This is the first one with the diagnose. This is the second one in just 1 week. This is the third photo in 2 weeks. And in the month, there was just a deep cluster. There were no more recurrences. And now the patient is going really, really well. But by the congestion in the veins and some characteristics, I gave just one dose of laxatives, and the improvement was so quick. Just cluster take out, and the patient don't come again to that consultation because she now is so better, and it's typically in Bolivia. So if you have a very good answer to the treatment, the patient will not come again. And they don't show some things. They don't send you photos. Society is more closed in that aspect. But she's going really, really well. So my conclusion on this big review, going through the organon to chronic diseases with our master and with a different masters of Materia Medica, I had this conclusion. Do the best you can until you know better. Then, when you know better, do better. And I believe that each patient help us in this path to learn always, because we're always learning with our patients. And I get so deep and so compromised with all my patients. So I make all these steps to review Kahneman, to review Organon, to review the chronic diseases, to review Materia Medica. So sometimes I believe that I take a lot of time for each patient, but I believe that they are unique. So we need to have that time for each of our patients. And always, of all of my patients, I know better, I learn more, and I get impressed with homeopathy effectiveness. So this is all my learning process that I can share with you as my notes, little notes. Maybe you know about that, but for me was a part of discovery of new materia medica and new things in the philosophy, homeopathic philosophy, to treat our patients. Yeah, so I have some troubles with connection, I believe, here. So, okay, so that was the conclusion. So thanks for your attention. Thanks for being there. Thanks for your patience. And always for me, it's an honor to be here with you all. And thanks to IFPH, that is a very big and important platform to discuss homeopathy in all that little ways of doctrine, philosophy, materia medica, and all that kind of things. So thank you very much. That's all, Dr. Daneshi. Thanks so much to all of you. Yeah, I am asking to open your microphone.
Yes, please transfer the hostship to me. Unfortunately, you are the host now. Can you transfer it to me?
Sure.
Yes. I shall make you co-host.
Okay.
Anyway, it's really a great session. You really show the beauty of homeopathy. You undertook different methodology of, say, choosing the remedy, medicine, and at last you find the right remedy, and that remedy work. And you are able to use the theory from our Hahnemannian method, that is the organ from the organon, and you got the result. Anyway, this kind of research work is needed when people used to take the case in detail, and then they choose either one of the repertory to go ahead and choosing the remedy. But instead, you undertook a task of analyzing the same case in different repertories and finding out the right remedy and right method, and you are able to use your knowledge in organon of medicine in rectifying the defect you might have expected in the treatment, and thereby you were able to avoid such a defect also. Congratulations once again, and it is up to Dr. Beatrice Krishna to begin the session. Please unmute. Those who want to speak to us can raise your hand so that we will allow you to unmute yourself. So get ready and raise your hand one by one. Over to Dr. Beatrice.
Okay. So, dear Marian, thank you so much for the very, very excellent presentation. And you had these different parts. First, talking about the organon and the different aphorisms. Afterwards, using materia medica in the different forms. And it's not so easy to differentiate between secale, hamamelis, lachesis, all these remedies. You did very, very well. Thank you so much. And also very interesting, the effect. You were starting with Caro Vegetabilis, okay, more or less. But the effect of arsenicum was so quick. Within 1 week,
Yeah.
you could see directly. Now we are on a different way. So my question is, did this patient, okay, you had as a local symptoms, it was burning, it was chilly, and but did you have also that woman? Did she have also constitutional arsenic symptoms? You felt it could be also a constitutional remedy for her. That is my question.
Yeah, no, that symptoms appear with carbo in the varicose ulcer illness. When I use arsenicum, that symptoms disappear. The first was on the burning sensation, and then start the healing of the wound.
Yes.
Yeah.
Mm-hmm.
But
So
no, she's taking carbobase because she has the antecedent of dyspepsia. And I tried. She's my patient for something like 15 years. I started with that patient when I was starting to practice homeopathy. So I was changing too many remedies with a slight evolution, not the thing that I really would like. And then we arrived to carbobase. And we arrived to carbobase because she has a tendinitis in the shoulder. So in that case, I find that remedy. I start with carbobase, and the changes was amazing in all aspects. So then I discovered that the best constitutional remedy was carbobase. So when the varicose ulcer appeared, with the varicose ulcer appeared the burning sensation, the painful ulceration, the thirst in small amounts, and the chilliness. Just in that case. So was the symptoms of the vital force on that intercurrent disease. But there are not the constitutional symptoms. It just appears with a varicose ulcer.
very interesting, very interesting. And also how the body shows which remedy he wants to have next, please. You were giving carbo vegetabilis and then appear burning and the thirst in little sips and showing I want to have that arsenicum, and really impressive, Mariam, how quickly the patient responded, because with the ulcer it's always a bit difficult, the slow process, and so it was a very quick response. Congratulations with that case, very very nicely presented also. Thank you.
Thanks, Beatrix. Thank you so much. But I have to be honest, I just arrived to these results, to this treatment, because I was attending to IFPH sessions. So I learned a lot in this time that IFPH is helping us to learn deeply homeopathy. So this point of view that now I have is thanks to IFPH. So thanks to all IFPH team that organize daily and amazing sessions.
Thank you, Dr. Maria, for such a wonderful comment and a very good question from Beatrice, and an excellent answer once again. And now I'm inviting Dr. Ambarish sir to say a few words. Please unmute.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. Mariam ji, and everyone. Namaskar. Very nice presentation. Case presentation is the beautiful describe the varicose ulceration. Many kinds of remedy: carbovate, silesia, pulsatilla, arsenic, solar remedy, and hemamalis, vipera. Carbovate is a very good remedy. Very good remedy, varicose ulceration. Due to oxygen, lack of oxygen in vein. So carbovate, black wood coal, make the medicine black wood coal. कार्बोवेट का एक हिंदी में कहावत है, जीते लकड़ी मरते लकड़ी, देख तमाशा लकड़ी का. जीते लकड़ी मरते लकड़ी. So very very thanks Dr. Marian John and miasmatic and related remedy. Excellent session. Thank you.
Thanks, Dr. Ramji. It was really amazing, your words. Thanks for your kind words. And that was the difficulty that I have in that case, because carbovate is so close in the ulcer varicose. with arsenicum album. So that was my decision, just start with carbo beige.
So now
But why I decided
हाँ,
then
भूल नहीं जाते
arsenicum
हैं, वो
was
तो
with the
यहाँ
blue
रोज आते हैं
borders.
पेशेंट ना, इसीलिए हमको तो पूछना काम है,
yes, sir. Sir,
पेशेंट रोज आते हैं, रोज 10 को 20 को आते
Sure.
हैं ना.
now I invite Dr. Sergio Castillo to say a few words, and you can ask your question also. Please unmute.
Sí. Marian, muy buena tu presentación. Muy buena tu
Gracias.
presentación. Muy ordenadita. Me encantó. Yo creo que debieses escribirla para poder tenerla y volver a revisarla. ¿Ya? Pero es un gusto haberte escuchado hoy día.
Gracias, Sergio. Muchas gracias. So I will translate to Dr. Danesh. Dr. Sergio from Chile, he says, thanks for the presentation, was so well ordered, and maybe you have to write it down to have and review in the future.
Okay. Then
Thanks.
now I invite Dr. Bob Lim to say a few words, as well as you can ask a question, Dr. Bob. Please unmute, Bob. Dr. Bob is from Malaysia, as you all know.
Yeah, I'm Bob Lim from Malaysia. I'd like to congratulate Dr. Marian for giving a very good insight about the homeopathy management for a very first way. And I think that this can also apply for deep vein thrombosis too. I think they more or less have similar symptoms, and based on the symptoms and matching with their similar with the homeopathy. I think Dr. Mariam, excellent. Congratulations, you have find the similar with arsenicum album. I think that was the similar remedy. Once again, congratulations and gracias for a very good presentation.
Thank you very
Over
much.
to you, Dr. Dai.
Yes, this presentation shows us that at times we need a single, not only a single remedy for a solution, but you can begin with the session with some the most similar, then you have to go with some more medicine and to complete the cure. Am I right, Dr. Maria? Was this method?
Thanks, Dr. Danesh.
Usually, sometimes people maybe think that the one remedy is enough for curing the case, but at times it may not be so. So you have to give some complementary medicine as a follow-up. Whether you have follow that method or directly went for in a different method.
Thanks, Dr. Danesh. Yeah, as Dr. Hahnemann says, you have to look up homeopathically remedies. So in an intercurrent disease, you need a very close follow-up of the patient. And something that I remember is the blue skin coloration around the wound. I never see that, and this is typical for arsenicum. So that was the symptom why I decided arsenicum, and it functions so well. And just to finish, we have 5 minutes. I will share my last slide. That was not possible. I really would like to finish with this quote of our master, because he really was a genius in his time and in our time. A gentle cure is the most perfect. The best medicine is the one that restores health most rapidly, most durably, and the least suffering. So this is a very important quote that marked my life, my professional life in homeopathy. And just to show this one is the picture of the road in my country, in my city. It's in a place that is called Los Yungas. So it's the most touristic attraction that we have in my city, because all the tourists just go there to face the dead. So I believe that we have a very, very stretched path with all the patients, and it's very difficult to decide. So as Ken says, if you don't know what you have to do, just wait. Don't do nothing, just wait and observe. And that was the case in this patient. I was just looking up what was happening. Was very difficult to differentiate in all these remedies of varicose ulcers. But the most important thing was to observe, and I really observed the blue borders in the wound. I tried to get the photographs, but it was so difficult because it was so slight, but was blue. I never saw in my life, was the first time, and was amazing. So that is the experience that I really would like to share with you, all of you,
Okay.
because just by observation, you can achieve the remedy, the right remedy.
Yes, exactly. Now it is over to Dr. Beatrice. You can make your comment, then you can ask the question, and at the end you can say a word of thanks to the session also.
Yes, I just wanted also to add that to treat alterations of the legs is not so easy. And I also remember a very difficult case, Mariam. I was fighting so much, first lachesis, afterwards vipera, afterwards sulfur. And at the end, it was a combination of, I showed the case here, it was really months ago. And at the end, it was a constitutional remedy which had been kalium carbonicum, but kalium sulfuricum in that case. And at that moment, you gave the right remedy. 1 week later, everything changed. So it's really, really impressive. But as you show your long way in your country at the mountains, it can be like this. Sometimes I totally agree. And thank you so much to choose this topic also, because it's an important topic with our patients. And congratulations once again for the very good and very didactic form to present, also with the paragraphs of the organon and to show how homeopathy is working. So thank you very much. Thank you very much to IFPH also. Thank you very much to Dr. Danesh, who always is inviting people to talk and moderating very well. And yes, always a pleasure to be with you.
Yes, Dr. Maria, you can say the conclusion. Also, you can say something if you want to say anything.
Thanks,
Okay.
Dr. Banerjee.
Oh,
Thanks,
okay.
Beatrice. Thanks to you all for being there, for your tolerance. I always following you. Now I have office time on these meetings, but I am following on YouTube. So my advice is just to follow all the sessions
Yes,
in live or in our YouTube channel, because you have always a treasure in all the sessions. So thanks, Dr. Daneshi, because you are always moderating so nice. And thanks
thank
to
you.
all the IFPH team. Thank you.
Thank you, Dr. Marian, and those who attend the session in this evening with us. Tomorrow we will have a session from Dr. Jessica Monterio, and she is Associate Professor, Department of Medicine, Kaili Homeopathic Medical College, Bangalore, and she will be talking about application of qualitative research in homeopathy. Another big subject is being discussed tomorrow. So hope all of you will be joining us tomorrow at the same time. With that, we come to the end of the day, 1770. Thank you all. Good night. It's over to Dr. Mariama John to moderate the Mariana session.